Altogether, MSH interventions in Kenya impact on approximately 15 million people. I'm a physician by training, and I did clinical practice in pediatrics for a number of years until I realized that the same children that I treated came back with pretty much the same condition, which has been brought up under the same circumstances. And I said, well, something else has to be done. And that something that has to be done has got to do with the family, with the community where these children were coming from. And then ultimately I realized that just knowing about public health is not enough, but you've got to strengthen the people who are working within the system. You've got to strengthen the institutions that do deliver services.
MSH, it gave me the knowledge. Not only me, it brought it down to the others because I'm able now to coach others. It showed me that you still have to move further to try and improve and take care of the community.
Our work in Kenya really is involved with saving lives through using the knowledge that we know, and that's why we are very much involved in using evidence and using the projects that we implement to generate that evidence and use it to implement the best practices.
With improved management, the impact is they wait less, the quality of services more, they're able to access more services, so we are able to provide them with the required drugs that they need.
We are involved in strengthening the supply chain systems for medicines.
We've been taught how to now keep drugs nicely, how to use AMCs. We've been taught how to make sure that we don't have expiry, we don't overorder. A lot of things, and it has been very significant for this institution.
We strengthen leadership, management and governance.
The leadership program managed to help us enhance our relationship in the community and in the facility. So as much as we are now together working as a team and understanding what we are doing, we are also able to show it in the community that we are working together even with the community members.
I'm a committee member in this facility, and I've seen this facility helpful to me because I can access treatment when I need, and also I can even link other people to this facility, and I feel I own it.
In capacity building, we use the evidence that we collect in our projects to train and provide short-term technical assistance. MSH Kenya builds the capacity of partner institutions to improve performance.
HOVIC is an organization which basically works with children living on and off the streets.
I find that Omega Foundation has been able to take HOVIC through the initial stages of putting its systems in place.
I think my personal dream is to see Kenyans attain the level of health status that has been attained in the most developed world.
Which their vision is to see a society where vulnerable children have access to opportunities to live meaningful lives.
My vision is to have the best maternal services in this community.
We believe one time the number of patients will reduce, but we'll have just clinics, somebody just going for a general examination. You know, instead of us going to look for them, they'll just come book in, come to be examined, make sure that they are healthy and go home. Instead of waiting until they're sick, that's the time they come.